Hey guys, my name is Helen Calderon and today we are going to be practicing units from 5 to 13 and we're going to start with unit 5 which is called Medical Practitioners number 1. The first exercise, write sentences to describe the work of the specialist in each branch of medicine. A dermatologist specializes in diseases of the skin. A rheumatologist treats autoimmune diseases. A traumatologist treats injuries from accidents. Pediatricians provide care for infants, children, etc. An obstetrician care for women during the pregnancy. Complete the table with words from A, B, C, opposite, and related form. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, noun, and noun, referring to activity or thing. Verb, specialize, specialist, specialization. Practice, practitioner and practice. Consult, consultant and consultation. Assist, assistant and assistance. Graduate, graduate and graduation. Qualify, qualifier and qualification. Find the prepositions in C opposite that can be used to make word combinations with the words in the box. Then use the correct forms for the word to complete the sentences. A pathologist specializes in diagnosing disease through examining cells and tissue. A pediatrician must enjoy work with children. An oncologist is interested in diagnosing and treatment of cancer. A psychiatrist must enjoy or must be good at consulting. A neurosurgeon must be good with her hands. Make word combinations using words from each box. Two words can be used twice. Look at A, B, and C opposite to help you. Consulting, general, group, health, internal, surgical, center, practice, specialties, medicine, practitioner, and room. The word combinations are general practitioner, health center, internal medicine, surgical rooms, group practice, consulting specialties. Now we are practicing Unit 6, which is called Medical Practitioners Part 2. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. The words are associate, house, on, provisional, radio, ward, call, diagnosis, officer, pager, round, and specialist. Associate call, provisional house officer, radio pager, ward round, specialist on. Match the descriptions with the job titles. Look at A, B, and C opposite to help you. A specialist register goes to Dr. Sweetwater has just started the second year of the foundation program. Medical director goes to Dr. Miller is in charge of the medical staff in Birmingham's hospital. Consultant goes to Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. SHO is Dr. Sign has started the training as a surgeon. PRHO or house officer is for Dr. Phillips has just graduated and is working in a large hospital in Birmingham. The next exercise is, are the following statements true or false? Find the reasons for your answers in A, B, and C opposite. A medical graduate become registered 2 years after graduation. This one is false. The system of training doctors in Britain is called Foundation Program. This one is true. The name of the senior house officer is no longer used in Britain. This one is true. The consultant is usually the first doctor to see new patient. This one is false. And the last one, when working in shifts, all doctors take turns to be on call. This one is true. The last exercise says, complete the text of a PRHO describing her job. Look at A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put on or take down. Later in the morning, I assess any new patients which basically involves taking history. On Tuesday and Friday morning, the consultant does her ward rounds, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like reading up request forms for blood tests and so on. In the afternoon, I have to prepare for any patients who are to be performed the next day. They're usually happy to be going home. And then, of course, there are the lectures and tutorials the in are being discharged program on Monday and Wednesday. Okay, unit number 7 is called nurses. The first exercise is complete the sentences. Look at A, B, and C opposite to help you. Someone who specializes in delivering babies is called a midwife. Someone who is qualified to assist nurses is a nurse practitioner. Someone who is not qualified but is able to assist nurses is a nursing assistant. A nurse who has qualified is a registered nurse. A nurse who specializes in health promotion is a community health nurse. A nurse who looks after a ward is a ward nurse. A nurse who works in the community is a community nurse. And the last one, someone who answers the ward telephone is a ward clerk. Make word combinations using a word or phrase from each box. Look at the opposite to help you. The words are carry out, change, check, give, remove, sutures, a procedure, an injection, a dressing, the temperature. Carry out a procedure, change a dressing, check the temperature, give an injection, remove sutures. Complete the sentences with the correct grammatical form to perform. An isotope brain scan is painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient conditions deteriorate, a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year we performed a randomized double-blind group study. Complete the sentences with the correct grammatical form for carry out. I now intend to carry out a larger study. Unfortunately, few properly controlled trials have been carried out so far. A number of studies have been carried out recently to look at his question. A right hemicolectomy was carried out and the patient made a full recovery. This procedure can be carried out in the emergency department.